Welcome to the Ames Community College Associate Degree Nursing Program online orientation for Fall 2017 admission. Completing this orientation in its entirety is mandatory in order to be eligible to be considered for admission to the nursing program to begin in August 2017. At the end of this orientation, you will be asked to print the mandatory online orientation verification form for Fall 2017, which you will sign and turn in with application materials during the designated time frame. The Ames Associate Degree Nursing Program has continuing approval status granted by the Colorado State Board of Nursing, as well as national accreditation granted by the Accreditation Commission for Education in Nursing, ACEN. Graduates of State Board of Nursing approved and nationally accredited nursing programs have greater prospects for securing employment and continuing education opportunities at the baccalaureate level. The Ames Nursing Program office is located in the Allied Health and Sciences Building, Room 203 on the Greeley campus. The Ames Community College Associate Degree Nursing Program provides students with the opportunity to learn skills to care for patients of all ages in a variety of healthcare settings. In addition to learning technical skills used in providing care, major emphasis is placed on the development of the attributes of critical thinking and professionalism. This rigorous program offers theoretical and applied instruction in classroom, simulated laboratories, and clinical settings. The ability to synthesize information and then coherently and succinctly communicate the information in written assignments is critical for program success. The nursing curriculum is a progressive sequence of nursing courses that build upon each other and build on the required general education courses. Therefore, it is important to understand that retaining knowledge gained in both your general education courses and nursing courses is essential for success in the nursing program. Nursing school should be considered a full-time commitment. Due to the fast pace and heavy academic demands in the nursing program, outside employment should be carefully considered. Students in the nursing program spend between 20 to 30 hours per week studying. This is in addition to classroom, laboratory, and/or clinical rotation time. The time frames and locations of clinical rotations vary with each course and may include days, nights, and/or weekends. The student must be able to meet his or her scheduled rotations. Clinical rotations may take place in Wyoming or Denver or somewhere in between. Students are responsible for their own transportation to clinical sites. Graduates of the Ames Community College Associate Degree Nursing Program will earn an Associate of Applied Science degree, or AAS, with a nursing major. Successful completion of the nursing program enables graduates to apply to take the National Council Licensure Examination for the Registered Nurse, known as NCLEX RN. Students in the nursing program who successfully complete the first year of the two-year program are eligible to take an additional nursing course in the summer between the first and second year of the program. With successful completion of the summer course, students earn a practical nurse certificate from Ames. A practical nurse certificate will enable the completer to apply to take the National Council Licensure Examination for the Practical Nurse, or NCLEX PN. On occasion, a student who earns a practical nurse certificate chooses to not return and finish the Associate of Applied Science degree, but most return to complete the final year of the nursing program. At this time, Ames does not have a track designed for LPN to ADN. The faculty strongly believe that completing the associate degree in nursing should be the first step in your nursing career. It is strongly encouraged that graduates of the program continue their education at the bachelor's level and earn a BSN, Bachelor of Science degree in nursing. While you are waiting to apply to the Ames nursing program, you are encouraged to enroll in other college coursework which may be required for the Bachelor of Science in Nursing degree, or BSN. Our Allied Health Advisors in the Student Success Center can assist you in identifying courses which may transfer and apply to a BSN degree. Ames offers two options for students to continue their nursing education: a partnership with UNC for dual enrollment and seamless transition into the RN to BSN program. Ames Community College Nursing Program and the University of Northern Colorado School of Nursing have partnered to allow students to be duly enrolled in a BSN program after the student is successfully admitted to the Ames nursing program, provided the student meets the RN to BSN prerequisite coursework requirements. Students are highly encouraged to take advantage of this opportunity as the local and national trend is progressing to the hiring of BSN prepared nurses. This program begins the summer prior to beginning the Ames nursing program and allows the student to take courses toward a Bachelor of Science degree in nursing at UNC while completing the Associate Degree Nursing program at Ames. After completion of the ADN from Ames, the student will have 2 additional semesters of coursework to earn the BSN from UNC. There may be additional liberal arts core courses required prior to completion of the BSN degree. Another option for students who successfully complete the Ames Associate Degree Nursing program to continue their education and earn a Bachelor of Science degree in nursing is the RN to BSN transition option. Ames and UNC have worked closely to develop seamless transition into the RN to BSN program. This slide identifies all prerequisite and general education courses required for the AAS with a nursing major degree. Let's talk specifically about prerequisite courses you will be required to complete before you may be admitted to the nursing program. For those of you who have attended nursing orientations in the past or viewed previous online orientations, some information may have changed from the past, so please listen carefully. BIO 201 Anatomy and Physiology 1, BIO 202 Anatomy and Physiology 2, ENG 121 English Composition 1, MAT 135 Statistics, and HPR 108 Dietary Nutrition are all considered prerequisite courses for the nursing program. In order to be eligible for admission consideration for fall 2017, you must have completed BIO 201, BIO 202, ENG 121, MAT 135, and HPR 108 by the end of the spring 2017 semester with a grade of C or better. It is possible for prerequisite coursework to be in progress during the spring 2017 semester. Again, in order to be eligible to apply for admission to the nursing program for fall 2017, you must have completed BIO 201, BIO 202, ENG 121, MAT 135, and HPR 108 with a grade of C or better by the end of the spring 2017 semester. If you are granted provisional admission status and have any prerequisite coursework in progress at an institution other than Ames during the spring 2017 semester, you will be required to submit official transcripts for the coursework no later than July 1st, 2017 to the Ames Records Department. Please note, courses must be eligible for transfer into Ames and demonstrate that a grade of C or better was earned, or you will no longer be eligible for provisional admission. Prior to entering the second semester of the nursing program, you must also complete BIO 204, Microbiology, and PSY 235, Human Growth and Development, with a grade of C or better. Please note that if you choose to delay taking BIO 204 and or PSY 235 until fall 2017, you will need to register for an online or evening course. Prior to graduation, an additional 3-credit-hour approved humanities or social or behavioral science elective or another approved substitute such as ENG 122 English Composition 2 must be completed with a grade of C or better. Please be aware of the following age limitations regarding prerequisites and general education courses. BIO 201, BIO 202, BIO 204, and MAT 135 may be no older than 7 years at the beginning of the fall 2017 semester. Therefore, these courses must have been completed after August 2010. PSY 235 and HPR 108 may be no older than 7 years at the beginning of the fall 2017 semester unless the student has taken those courses as part of an earned AA, AS, AAS, BA, or BS degree from a regionally accredited institution. ENG 121, or an equivalent course that is older than 10 years and was taken at another college, university other than Ames Community College, may not be eligible for transfer credit unless the student has earned an AA, AS, AAS, BA, or BS degree from a regionally accredited institution or taken the Accuplacer Sentence Skills Test and received a score of 110 or higher. This slide identifies the courses to be completed once you are officially admitted to the nursing program. Now, it is important to discuss a few items you need to know prior to applying to the Ames nursing program. Students must be 18 years of age at the time they begin the nursing program. Ames Community College nursing program has adopted technical standards. Candidates for the ADN degree must be able to meet these minimum standards with or without reasonable accommodations for successful completion of program requirements. Visit the prospective student link on the nursing website to view the technical standards. Again, if admitted to the Ames nursing program, the student must be able to meet these minimum standards with or without reasonable accommodations. All applicants who receive provisional admission to the Ames nursing program are required to apply and pay for a background check and drug screens. If an applicant has a disqualifying offense or fails to secure negative drug screens, he or she will be prohibited from entering the nursing program. Visit the prospective student link on the nursing website to view disqualifying offenses. No applicant should proceed with having a background check or drug screens until he or she receives provisional admission to the nursing program. Once an applicant receives provisional admission, he or she will be provided with clear details and steps regarding how to proceed with the required background check and drug screens. Please note, detection of marijuana is considered a disqualifier. Prior to beginning the program, it is important to note that a clinical site has the right to deny access to their facility based on the results of additional required fingerprinting, drug screens, and/or background checks. If access is denied, the student may be unable to complete the course requirements to successfully pass the course and/or graduate. At this time, the cost of additional fingerprinting, drug screens, and/or background checks required by the clinical agency is typically paid for by the clinical agency. But it's important to make you aware that the financial responsibility for these additional checks may eventually be passed on to the student. My Clinical Exchange is a clinical student placement platform that has been established by clinical agencies to manage student clinical rotations and compliance. It will be the student's responsibility to register and pay for the platform once admitted into the nursing program. Some clinical sites may require additional documentation. Visit the prospective student link on the nursing website to view additional clinical requirements. Please take some extra time to read this slide. It is important for students interested in the nursing program to know that if you were previously enrolled in another allied health program at Ames and during the clinical rotation you were banned or prohibited from participating in educational experiences at that facility, then you are ineligible to enter any allied health program at Ames. If you were to be admitted to an allied health program at Ames, and it is discovered that you were banned while a student in another program, you will be expelled, and all tuition and fees will be forfeited. If you are a student with a documented disability, you should contact the Disability Access Services Office to set up an appointment to determine whether you are eligible for any accommodations. All accommodations must be approved through the Disability Access Services Office. Now, let's talk about the steps to apply for admission to the Ames Nursing Program for Fall 2017 admission. Step 1. You must apply to Ames Community College by completing an application for admission and submitting it to Admissions, Registration, and Records. This can be done online. Applications are only good for 12 months. If you have a prior application on file and have not attended Ames in the last year, you will need to reapply. On your application for admission, you should declare pre-nursing as your major. For advising and financial aid purposes, it is critical that you declare the appropriate major. Step 1 continued. Begin by applying for financial aid if needed. Complete Ames Online New Student Orientation. This orientation can be found when you log into your My Ames account, then click on the Student tab, and then click on the New Student Orientation link. Assess for college placement or provide transcripts to meet assessment requirements. If you plan to register for pre-nursing courses, schedule an advising appointment with an allied health advisor. The advisor will help you develop a plan for completing prerequisite coursework. See the next slide for contact information. To make an appointment with Kelly or Janet, please telephone 970-339-6251. You should plan to schedule a 1-hour appointment. Make sure that prior to meeting with Kelly or Janet, you have applied to Ames Community College, completed the Ames Online New Student Orientation, and have assessed for college placement or provide transcripts to meet assessment requirements. To contact Kelly or Janet directly, it is recommended you email them with your questions. Kelly and Janet are often able to answer email in between advising appointments. If leaving a telephone message, you should expect a 24-hour delay in a return call, as they are both quite busy advising other students. Step 2. You must complete this mandatory online orientation for Fall 2017 admission consideration. After completing this orientation, you must submit a signed, mandatory online orientation verification form for Fall 2017 with your nursing program application materials. Visit the prospective student link on the nursing website to print the verification form. Step 2 continued. You must complete, sign, and submit an AIMS Nursing Program application for Fall 2017 admission consideration form with your nursing program application materials. Visit the prospective student link on the nursing website to print the application form. Step 3. Submit unofficial transcripts from all colleges, universities, including AIMS, with your nursing program application materials that demonstrate completion of or current enrollment in BIO 201, BIO 202, ENG 121, MAT 135, and HPR 108, or approved substitutes. Please note that unofficial transcripts must include student's name, semester course or courses taken, number of credits, and grade awarded. In addition, you must submit official transcripts to the AIMS Records Department for courses taken at an institution other than AIMS for transfer evaluation. Step 3 continued. If you have already completed BIO 204 Microbiology and or PSY 235 Human Growth and Development and or an approved 3-credit hour elective with a grade of C or better, these courses should be reflected on the unofficial transcripts you submit to the AIMS Nursing Program Office with your nursing program application materials. Again, a grade of C or better is required for BIO 201, BIO 202, ENG 121, MAT 135, and HPR 108. BIO 204 and PSY 235 must be completed with a grade of C or better in order to progress to the second semester of the nursing program. Step 3 continued. No later than July 1st, 2017, you are required to submit official transcripts to AIMS Records Department demonstrating completion of any prerequisite courses taken at an institution other than AIMS. Visit the prospective student link on the nursing website for information on transfer of academic credit. Please be aware that all transfer coursework must be evaluated by the AIMS Records Department. Step 4. You must submit documentation to the Nursing Program Office of having a current, state-issued, non-restricted Certified Nurse Aide CNA license with your nursing program application materials. Acceptable forms of CNA license documentation include a copy of your current license or a copy of verification from a State Board of Nursing website. Step 5. You must submit official, verifiable documentation of your HESI A2 Admission Assessment Exam scores to the Nursing Program Office with your nursing program application materials. The required minimum scores for each section of the HESI A2 for Fall 2017 admission consideration is 75%. The sections to be considered for admission are reading comprehension, vocabulary and general knowledge, and math. Step 5, continued. The following information is specific to the HESI A2 for Fall 2017 admission consideration. HESI A2 scores earned between August 2016 and March 23, 2017 may be used to meet admission standards. The applicant's HESI A2 scores for reading comprehension, vocabulary and general knowledge, and math must come from the same exam. HESI A2 may be taken only one time between August 2016 and March 23, 2017. Consequently, you are advised to prepare prior to testing. HESI A2 study materials may be found online, in the Kiefer Library, and in the Ames bookstore. If you have taken or plan to take HESI A2 at a site other than Ames, official verifiable results from that site must be submitted to the Nursing Program Office. The HESI A2 is offered at the Ames Testing Center by appointment only. Please see the Testing Center's phone number on this slide. The cost of the HESI A2 varies based on whether you are a currently enrolled Ames student. Visit the prospective student link on the nursing website for important HESI A2 information. Step 6. Now, let's discuss the process for application submission. All application material must be submitted between March 1st and March 24th, 2017 by 3 p.m. No late submissions will be accepted. Step 6, continued. The following must be completed and submitted to the Ames Nursing Program Office, AHS 203, between March 1st and March 24th, 2017, no later than 3 p.m. Signed mandatory online orientation verification form for Fall 2017. Completed and signed Ames Nursing Program application for Fall 2017 admission consideration. All unofficial transcripts demonstrating completion of or current enrollment in BIO 201, BIO 202, ENG 121, MAT 135, and HPR 108 or approved substitutes. Unofficial transcripts must demonstrate that completed courses have been completed with a grade of C or better. Documentation of a current state-issued, non-restricted, certified nurse aide CNA license. Official, verifiable documentation of meeting the minimum required scores on the HESI A2 Admission Assessment Exam. Now, let's talk about how applicants to the Ames Nursing Program are ranked and selected. There are two phases to the application process. The first phase is based on the applicant's scores on the HESI A2 Admission Assessment Exam in the following areas: reading comprehension, vocabulary and general knowledge, and math. The second phase consists of a proctored, handwritten response to selected questions. Phase 1 and Phase 2 are equally weighted. Provisional admission will be granted to applicants with the greatest number of points following completion of Phase 1 and Phase 2. The number of points an applicant may earn for scores on the HESI A2 are as follows. Reading comprehension. Applicants' percentage earned times 30%. Vocabulary and general knowledge. Applicants' percentage earned times 50%. Math. Applicants' percentage earned times 20%. Now, let's talk about Phase 2. The proctored handwritten response consists of a series of questions that the applicant must answer. It is recommended that you take some time to review these concepts and descriptions to prepare for the proctored handwritten response. The questions address the following components: diversity, individual values, motivation, coping strategies, career values, and communication. This slide provides additional information regarding the proctored handwritten response. The proctored handwritten response will be administered on Thursday, April 6, 2017, from 2 to 4 p.m. in the Allied Health and Sciences Building on the Greeley campus. An email detailing the process of participating in Phase 2 will be sent to the applicant using his or her Ames email account on Thursday, March 30, 2017. This email will outline the steps to be taken to participate in the proctored handwritten response on April 6, 2017. Be sure to check your junk mail or spam boxes on the evening of March 30, 2017 if you have not received the email in your inbox. The applicant's score on the proctored handwritten response will not be shared with the applicant. Provisional admission is granted following the completion of Phase 1 and Phase 2. Applicants who are granted provisional admission will receive a certified letter informing them of such. Applicants who are not granted provisional admission will also receive a certified letter. All certified letters will be mailed on May 12, 2017. Following provisional admission, there are additional requirements that must be met in order to be granted official admission to the nursing program. The following requirements will be outlined in your provisional admission letter. If BIO 201 and/or BIO 202 and/or ENG 121 and/or MAT 135 and/or HPR 108 are in progress during the spring 2017 semester, you must submit unofficial transcripts to the nursing department showing a final grade of C or better. This documentation must be submitted to the Ames Nursing Department before 5 p.m. on May 25, 2017, regardless of whether you are enrolled at Ames or elsewhere. And if courses were taken at an institution other than Ames, submit an official transcript to the Ames Records Department by July 1, 2017, verifying that you have completed the courses with a grade of C or better, and that courses are eligible to be transferred into Ames. The applicant granted provisional admission must also sign the Technical Standards Acknowledgement Form. The applicant granted provisional admission must also provide a cleared background check and negative or cleared drug screens. Do not order the background check or drug screens until you are notified of provisional admission. You will receive detailed instructions on how to proceed with a background check and drug screens with your letter informing you of provisional admission. After provisional admission, you will also be required to provide documentation of the following: immunity to measles, mumps, and rubella, immunity to varicella or chickenpox. A doctor's note attesting you have had varicella or chickenpox will not suffice. Immunity to hepatitis B, or you may sign a declination form. A vaccine for tetanus, diphtheria, and pertussis, Tdap, that is less than 10 years old. A vaccine for influenza will also be required for fall 2017, but the provisional applicant will be notified of the date required for the vaccine. Do not proceed with obtaining an influenza vaccine if you are granted provisional admission until you are instructed to do so. Please note, costs associated with these health requirements are the student's responsibility. You will only be required to provide this documentation if you are granted provisional admission. You will also be required to provide documentation of 2 tuberculosis or TB skin test results. There is a specific timeline for obtaining the TB skin tests with results. The provisional admission letter will include specific instructions for obtaining the skin tests. A chest x-ray or a note from your physician may be required in lieu of receiving TB skin tests. You will also be required to submit documentation of having current American Heart Association BLS for healthcare provider CPR certification. Only American Heart Association BLS for healthcare provider certification is acceptable. The certification must be valid through June 2018. In order to graduate from Ames Community College with an AAS degree with a nursing major and be eligible to apply to take the Registered Nurse Licensing Examination, you must complete all courses required for the degree with a grade of C or better and meet all requirements established by the college for graduation eligibility. It will be your responsibility to apply for your degree and the licensing examination within the deadline set by the college and the Colorado State Board of Nursing. Please note, the cost of the licensing examination is the responsibility of the graduate and is not included in tuition and fees. This slide presents information regarding registered nurse salary information taken from Career One Stop 2016 Wage Table. The next 3 slides outline the estimated costs of the nursing program based on 2016-2017 tuition and fees and other expenses. Before ending this mandatory online orientation for Fall 2017 Nursing Program Admission Consideration, let's review the steps for you to follow in order to be considered for admission into the nursing program to begin in Fall 2017. Between March 1st and March 24th, 2017, by 3 p.m., you must complete and submit the following items to the Nursing Program Office, located in the Allied Health and Sciences Building, room 203 on the Greeley campus. Absolutely no late submissions will be accepted. Signed mandatory online orientation verification form for Fall 2017. Completed and signed AIMS Nursing Program application for Fall 2017 admission consideration. All unofficial transcripts demonstrating completion of or current enrollment in BIO 201, BIO 202, ENG 121, MAT 135, and HPR 108 or approved substitutes. Note, if granted provisional admission and you fail to earn a grade of C or better in BIO 201 and or BIO 202 and or ENG 121 and or MAT 135 and or HPR 108, you will forfeit your seat. Documentation of a current state-issued, non-restricted certified nurse aide CNA license. Official, verifiable documentation of meeting the minimum required scores on the HESI A2 Admission Assessment Exam, reflecting scores of 75% or greater in the following areas: reading comprehension, vocabulary and general knowledge, and math. This concludes the mandatory online orientation for the AIMS Community College Associate Degree Nursing Program for Fall 2017 admission consideration. Best wishes in your educational endeavors.